Hey Jordan, this is just a little packet of stuff that we give our patients whenever they come in to have a baby here. So this is a letter from our manager, Jessica, thanking you for choosing our birth center. It says that our expectation is that you leave feeling like you were provided excellent care during your stay. So her phone number and her email address are on here, and you can reach out to her if you think you have anything that you need to talk to her about, something that was really excellent or something that might need improvement. And then we always like to let our patients know, you'll get a phone call from us just to check on you and baby at home to make sure you guys are doing okay. And then you'll probably get another phone call from a survey company asking how your stay was, and we want you to say it was excellent if you feel like it was. And then also within this packet you have our pain information. This is just about pain scale that we use here. 0 is no pain, 10 is the worst pain you've ever felt. And your job after you deliver is to let somebody know if you're hurting. So we try to come around about every hour to check to make sure you're doing okay. But if you are hurting in between that time frame, just call out, let somebody know, and we would be happy to bring you something if it's time. This is just a little bit about your stay. So we encourage you to have people here with you during the labor process, but we always want you to know that if we have to have people step out, we have them go to the waiting room for your privacy as well as privacy of other patients. Anybody under the age of 12 needs to be supervised by an adult at all times, which is not you. Nobody should dump off your kids and peace out, because you're not going to be able to jump up and take care of them like you normally would. Anyone with cold or flu symptoms should stay home. If at any point you or your doctor want us to limit visitors, we will do that. And then when you're taking care of the baby after delivery, if you need to get out of your room because you get a little claustrophobic, just put the baby in the crib and take a walk with the baby in the crib. We just don't like to see people carrying the baby in their arms for safety purposes. At nighttime, we encourage you to keep your baby with you 24 hours a day. Babies go home, you will feel more confident in your care with the baby, and the baby will actually sleep better being right there with you. And then we're just happy that you're here with us today. This little packet here has a lot of good information in it for you to go over. In the front, you're going to find our Mother Baby Care booklet. There's also a video that we will have you watch, and there's a step-by-step direction here on how to find that you can watch. Expectations on breastfeeding your baby within the first day of life in the hospital, and then just some other little pamphlets about postpartum depression, safe sleep, safe bathroom temperature, all kinds of good stuff there for you.
Thank you.
You're welcome. Okay, so now that I'm done with your guys' assessment, just want to let you know, baby will be 24 hours old in a couple hours. And at that time, I'm going to come back and we're going to do the baby's PKU test.
Is he going to cry?
Well, he probably will.
I'll probably cry.
It'll be okay. We'll get through it. So all it is I'm going to put a little warming pack on the baby's heel, and we're going to poke his heel, and there's 7 little circles I have to fill up with his blood. And we can do it a couple different ways. You can hold the baby, he can be skin to skin, you can breastfeed, you can even just stick your finger in his mouth, have something for him to suck on, and he'll just do a whole lot better if he's in here with you or with dad, somebody talking to him. And then we're going to do his hearing screen, which is a little probe I'll put in his ear, and it's fine, all of your guests can stay, we just have to be quiet for a couple minutes while the test runs. As long as the environment stays nice and quiet, we can move right through it. And then we're also going to do a heart defect screening, which is a little probe on his hand. You might remember wearing that little light on your finger when you were in labor. Checks your pulse ox. We're going to put one on his hand and on his foot, and then that just checks for different heart defects. Kind of gives us a warning if there's something there. And that's all we're going to do. Shouldn't take much more than a half hour.
Sounds good.
Okay. Hey Jordan, it's Renee again. Alright, so we're going to get all those 24-hour testing procedures done that I told you about. This is the hearing screen machine. It's a little big and clunky looking, but
is everything okay though? Because they didn't do any of this stuff last time.
Yeah, so this is just something new that we do with, we're baby friendly now, so we try to keep our babies with our moms as much as possible. So this just kind of keeps you guys together, limits the time that you guys are separated. So we'll do his hearing screen first. While he's nice and sleepy, we'll do the PKU last.
Okay, that's the one where I'm gonna cry?
Maybe.
Okay.
Okay, so we're all done with that hearing screen, so I'm gonna get ready to do baby's PKU now.
I just don't really know how I feel about this. Okay. I mean, this didn't happen last time, and I'm just like really emotional right now. And I think that maybe, can you just take him? Like, I understand rooming in, you can bring him right back, but I don't want to see this.
Okay.
Sorry.
If that makes you more
Am
comfortable.
I a bad mom?
No, you're not a bad mom.
Okay.
Sometimes it's just too much to handle, and we don't mind. If you really don't want to do it in here, I can take him to the nursery, and I'll just bring him right back.
Okay. I think I feel better about that.
No problem.
Okay. Shh.
Hey Jordan, what's going on? I saw
A
you put
lot.
lights on.
A lot.
Okay.
Look, he's sleeping, baby's crying, I'm tired.
Okay.
I just need wake him up. I just need a break. Breastfeeding's not going good. The baby just is eating and eating and eating. I was up all night in labor. My butt hurts really bad. I'm hungry, really hungry. I just need you to take him. Like, I can't do this right now. I'm about to lose it.
Okay, that's fine. So how about we do a few things? I'll get you some pain medicine. I'm gonna get you a snack. We will wake him up later, and let's get this baby all wrapped up. So I know sometimes that feeding, when they're feeding all the time, is exhausting.
It's like constant. Like,
I know.
this is awful.
It's actually good. I mean, it wears you out, but it's good. Baby's doing the right thing. But sometimes it does get to us after a while, and you just need some time to just kind of hit the reset button.
I'm about to lose it.
Okay. Well, I will get you some pain medicine. We'll get you a snack. You can shut the lights off, and you can have a little break.
Just like a little break would be just great.
Okay. And then how about when the baby is acting hungry, I can bring him back?
Yes.
Okay.
You
Sounds
can
like
take
a
him
plan.
with you too if you want, because he's no help.
Well, maybe you both can have a little nap, and then we'll just readdress those things when the baby comes back.
Okay.
Okay. Come on, buddy.
Can I help you?
Do you think someone could just come take the baby to the nursery maybe for a little bit so I can get some sleep?
I'll send your nurse in.
Thanks.
Hey, I just saw your light turn off. What's going on?
Hey, so I know he's sleeping, but I'm just really tired and I want to get some rest, and I just feel like I can't really sleep because I'm just kind of nervous. It's my first baby, and I just want to make sure he's breathing. I keep like touching him and I keep
Oh, sure.
looking, and I just really want to get some sleep. So I thought maybe you could just like take him for a little bit, and then I can just call you when I wake up.
Okay, well, the baby looks like he's sleeping pretty good. I feel like you could probably shut your lights off and get a nap.
I mean, he's gonna be okay though. Like,
Oh, yeah.
he's not gonna like choke and.
You know, that's probably the number one fear of new moms. Baby's not breathing, or the baby's gonna choke on something. You're not gonna sleep as deep as you normally would right now because you're so worried about those things, but you and the baby will actually sleep much better together. If you fall asleep and you hear another baby cry out there, you might actually think it's your baby, and it may not be. So you guys will sleep better if you stay together.
I guess that makes sense.
I mean, give
Okay.
it a try and just see
Okay.
how it goes.
Okay, I'll try.
Okay. Sounds good. Get some rest.
Okay, thanks.
Okay. No problem.